Hi, everyone. Welcome to the session on response to warnings. In this session, we will explore the critical role of responding effectively to warnings and how a well-coordinated response can save lives and reduce damage in the face of multiple hazards. The three key objectives for the session are: 1. Understand the critical components of an effective response. Participants will explore the essential elements required for a timely and coordinated response to warnings, including pre-established plans, community preparedness, resource mobilization, and real-time communication. 2. Identify the challenges and best practices in responding to multiple hazards. Participants will analyze the complexities of responding to simultaneous or sequential hazards and learn best practices for overcoming challenges like resource allocation, coordination, and public communication. And 3. Enhance knowledge of community-based response and coordination among agencies. Participants will examine the role of local communities in responding to warnings, the importance of inclusivity, and the necessity of strong coordination among various agencies to ensure an effective, scalable response across hazard types. Response in a multi-hazard early warning system refers to the actions taken after a warning is issued to reduce risk and minimize damage. It requires coordination between various stakeholders, including emergency services, local authorities, and communities. The speed and efficiency of the response are critical, especially in situations where multiple hazards might occur simultaneously or in quick succession. An effective response to warnings requires several elements. First, pre-established emergency plans must be in place, allowing authorities and communities to act quickly. Community preparedness is also essential. People need to know exactly what to do when a warning is issued. Timely mobilization of resources, like rescue teams and medical supplies, is key to reducing harm, and real-time communication between responders ensures a coordinated and flexible response. Responding to multiple hazards simultaneously introduces several challenges. For one, emergency services may have to respond to more than one event at the same time, such as a flood following a cyclone. This leads to competition for resources, where agencies must prioritize which response requires immediate attention. Coordination between multiple stakeholders becomes more complex, and there is also the risk of confusing the public if warnings for different hazards conflict or aren't clear. Preparedness is the foundation of any effective disaster response. It starts with having detailed emergency plans in place that outline how to respond to different types of disasters. Regular training and drills are also crucial, helping responders and communities practice how to react in real time. Finally, conducting thorough risk assessments helps us understand what we're preparing for, so we can tailor our plans to address the specific hazards and vulnerabilities in each region. Interagency coordination is essential for an effective response to warnings. A unified command structure helps manage resources and decision-making, while real-time information sharing ensures everyone has the latest data. Each agency must clearly understand its role, and joint simulations and drills can prepare all stakeholders for real emergencies. This ensures that when a warning is issued, there is a coordinated and seamless response. Communities play a vital role in responding to warnings. Local leaders and knowledge can be incredibly valuable as they understand the specific risks and resources of their area. To be fully prepared, it's important to ensure that communities receive training and participate in regular drills. Additionally, response plans must include vulnerable groups like people with disabilities to ensure their safety. After the event, feedback from the community helps improve future response efforts. Once a disaster occurs, speed is critical. Resources such as rescue teams, medical supplies, food, and water need to be mobilized and deployed to affected areas as quickly as possible. Managing logistics and transportation efficiently is also crucial to ensure that resources reach the people who need them most. Having sufficient financial and technical resources available ensures that the response is sustained and scalable as needed. Real-time communication is crucial during the response phase. Continuous updates keep both responders and the public informed of new developments. Two-way communication, gathering feedback from communities on the ground, helps authorities adjust their responses. Using multiple communication channels ensures that everyone, especially vulnerable populations, is reached. The ability to adapt the response based on real-time information is essential for handling evolving situations. Let's look at an actual case of response in a multi-hazard scenario. In May 2020, Cyclone Amphan hit Kerala while the state was already grappling with the COVID-19 pandemic. With the country under lockdown, authorities faced the dual challenge of evacuating people to safety while preventing the spread of the virus. This scenario posed unprecedented logistical, health, and communication challenges, as thousands of people living in coastal areas were at immediate risk. Thanks to early cyclone alerts from the Indian Meteorological Department, the state government in Kerala had time to prepare for evacuation. Authorities immediately recognized the need to plan for both the cyclone and the pandemic. Resources such as food, water, personal protective equipment or PPE, and medical supplies were stockpiled at evacuation centers. Additionally, shelters were reconfigured to ensure social distancing could be maintained, which required identifying additional facilities to avoid overcrowding. Coordination was key to managing this dual crisis. Kerala's health department, disaster management authorities, and local governance units worked together to create an integrated response plan. Dedicated COVID-19 response teams ensured that public health measures were maintained throughout the evacuation. The number of shelters was increased, and their capacity was reduced to allow for social distancing. NGOs and local leaders also played a critical role, ensuring compliance with COVID-19 safety measures while helping with the evacuation process. The evacuation strategy prioritized high-risk coastal areas, with special attention given to the elderly, those with underlying health conditions, and COVID-19 positive individuals. Health checks were conducted at evacuation points, and anyone showing symptoms was isolated and sent to separate facilities. Shelters operated at reduced capacity to ensure social distancing, requiring more facilities than usual. Evacuation transport was carefully managed, with buses regularly sanitized and passengers provided with masks and sanitizers. One of the biggest challenges during this evacuation was balancing public safety from the cyclone with the risk of spreading COVID-19. Despite resource constraints, such as shortages of PPE, the state worked to prioritize public health. However, shelter overcrowding remained a risk, and some evacuees feared contracting the virus in shelters. Public fear was significant, and some residents hesitated to evacuate, preferring to shelter in place despite the cyclone threat. Local volunteers and NGOs played a critical role in Kerala's evacuation response. Volunteers helped manage shelters, distribute PPE, and enforce safety protocols. NGOs partnered with local authorities to provide food, medical aid, and special support to vulnerable groups like the elderly and people with disabilities. They also played a vital role in communicating with communities, reassuring them about COVID-19 safety measures and encouraging them to evacuate despite their fears. Despite the challenges, Kerala's dual crisis management was highly effective. Over 60,000 people were safely evacuated with minimal disruptions, and there were no major COVID-19 outbreaks reported in the shelters. The state's preparedness and coordinated response resulted in minimal loss of life from both the cyclone and the pandemic. By strictly following health protocols in evacuation centers, authorities successfully reduced the risk of virus transmission. This case provides valuable lessons for managing multi-hazard scenarios. One key takeaway is the importance of preparedness for simultaneous crises. Building public trust through clear and consistent communication helped ensure people complied with evacuation orders. Flexible and scalable response plans are also essential, as the response had to adapt to both a natural disaster and a public health crisis. Finally, community involvement played a crucial role, emphasizing the need for local leadership and volunteer engagement in disaster response. In conclusion, Effective disaster response requires a comprehensive approach, bringing together several key elements. The 8 critical areas are preparedness and pre-planning, clear communication, coordination, resource mobilization, community involvement, real-time monitoring, adaptability, and post-disaster recovery planning. With that, we have finished the session on response to warnings. When you are ready, please move on to the last session of Module 2. Thank you very much for your attention.